Is there anything that runners should be extra cautious of when they're outside? And, what are your top safety tips besides the reflective piece? Maybe something else too. What do you guys think?
Well, one thing that you definitely have to be careful of is cars. So New York City is very busy and lots of traffic. And so you got to pay attention to your surroundings. And I think sometimes, especially people who aren't used to running in the city as much, or maybe new to running in the city, you're used to putting your headphones on and just running and, everybody likes it for their mental health, kind of ignore the world, get in your own zone. But you can't do that here. You've got to really pay attention unless you're in a protected area, like Prospect Park or Central Park, where, even then you still got to pay attention to the bicyclists, especially, in the summer here, New York City gets a lot of tourists and a lot of people that aren't from the city aren't used to watching for, the amount of pedestrians, amount of bicycles that are out there. And so they may do things that we don't normally anticipate that drivers in New York City would do, whereas they turn right in front of bicyclists or things like that, as New Yorkers, we're more accustomed to watching out for, but people that aren't from New York may not be. So, it doesn't mean you can't run with headphones, but certainly, they need to be on they don't need to be on the noise cancellation setting where you need to be able to hear your surroundings as well and be able to pay attention to those and watch for, cars and bicyclists. One of the things that I see that I get kind of concerned of is, people running in the bicycle lane. The bicycle lane is not for runners. The bicycle lane is for bicycles. And especially with the electric bicycles, some of those come pretty fast and they can't always dodge you very easily. And so, run on the sidewalk. I know you have to avoid people, and it kind of stinks to constantly be zooming in and out of people, but it's much safer than, getting hit by a bicycle.
All right, Adam, anything else to add?
No, Dr. Robinson, you hit so many nails on the head, and this preponderance of cyclists, and I am one of them, but going in the wrong direction on the streets. And I mean, I will tell my daughter, before you step out onto the street, you have to look left, right, and left again. And these e-bikes, they literally, they're fun, and I do city bike too, but they can be a hazard. So that in particular, I can't chime in enough how much I think that's one of the biggest dangers that are new to us here in the city. And the other thing that I've started to realize, especially as I've been out and about jogging in the winter and with all the construction, some of these metal gratings and the plates that they put on the to cover the asphalt, some of them are just tremendously slippery when the weather is bad. And whether it's jogging over the gratings that are covering the subway vents or any of those things, so these things that stick up out of nowhere and are slippery are some of the bigger hazards I've found. So yeah, I agree with you on all those points, and the idea of being aware of your surroundings. New York is a city like no other, and the kinetic, the dynamic, right, the frenetic pace of it is it's great. And if we think of jogging as you're kind of like a soldier in some way getting around, and it's an obstacle course, that's great. But if you're looking for the zen of it, it is hard to find. And I know that's why people will use their headphones. And perhaps, in addition to your suggestion of turning it down, maybe just leave the thing home. I know that's crazy, but if that can't be done, maybe just one earbud. And at least that way you're sort of tuned in to the world around you a little bit, with one ear picking up the ambient noise or the honking or the danger that might be approaching, which you'd be, unaware of otherwise. So I think those are my big tips. But yes, thanks.
All right, great. And Dr. Robinson, I think you have a question for Adam now. Oh, you're muted, Dr.
Yeah, sorry. Adam, I get asked this a lot, and so I would like your opinion. What do you suggest for people as far as ways to warm up, ways to cool down? How much stretching should they do prior to a run to help prevent injury? And what are the best kind of stretches to do?
Mhm. I mean, I think that it does depend on several factors. If you're going to go on a introductory run and you're just going to go as a novice, you're going out for a mile or two or three, it's different. The idea of preparing, however, for the longer distance runs, to me, that starts to bring up bigger things. And that I took this question as like warm up a little bit broader. And to me, it really starts in the days before. You could even say in the weeks before, with nutrition and with hydration. And let's just say that you're going to take a big run tomorrow. To me, one of the number one things is to pre-hydrate. You can't just go out and before the day of the morning of your run, drink a gallon of water. It doesn't work. If you are dehydrated from being inattentive to your body's water needs the days before, you kind of enter sort of with a little bit of a deficit, and you try to make up for it, and it doesn't always work like that. So pre-hydration is an interesting way that I would consider to warm up, and that would be, the day in advance a long run. And we're not talking, 2-3 miles. I'm talking about going, more of a pre-marathon training, 5-10 miles, especially when it's hot out. You need to be pre-hydrated. Number two, I would say, many people will think, oh, I'm going to just jog slower to warm up for my long run, and the first mile will just be easy. But I feel that even 5 minutes or 10 minutes of something besides that is great. And the things I recommend are pretty much the following. Dynamic stretches. I like the idea of doing a full depth functional squat where you're using your calves, your quads, your glutes, you're getting the whole body moving. I like walking lunges. It's dynamic and you're taking a nice step stride to stride, and you're getting a stretch as well as getting some strengthening out of it. And then moving into things like leg swings, where you're sort of a pendulum, kicking the leg up and back to really engage the hip, and then going into hip openers, where you're standing on one leg and flexing the hip and rotating it out to the side. There are many, many things, including core work. So in addition to the hydration and the dynamic things, to me, if you're going to be running and asking your body to support you from bouncing on one leg and jumping from one leg to the next, your core needs to be awake. And to wake it up, I'll have people do planks, forward planks, side planks, bridging, and do that over the course of a few minutes. You should be able to target 30 to 60 seconds per position. And those are the things I'll have patients do in the 5-10 minutes at least before they take a long run. I don't want them to get exhausted before a long run, but I want them to sort of tell the body, hey, it's time to wake up. Don't wake up and just get up and run. If you're going on a longer run, your body needs to be awake before you run. And that might mean you're waking up 2 hours before that long run, because you're really going to be depleting some of your energy stores. And I think the body needs to be awake, and the metabolism needs to rise up enough to get you ready to run those longer distances. So there's no simple one answer. You could talk to 10 people and probably get 10 different answers, but those are some of the biggest tips I'll give my clients and friends and patients.
All right, awesome. And Dr. Robinson, can you give us some tips on how to avoid getting shin splints? Because I know that's a popular injury with runners.
Yeah, I think probably most people know if you run long enough, at some point in time, you'll probably experience shin splints at some point in your running career. So shin splints, are usually caused by some tendinitis in the tendons of the calf and the anterior aspect of the leg as they attach onto the big bone in the lower leg called the tibia. And so that people call that your shin bone. And so that's what shin splints are. It's more of a tendinitis. So there are some things that you can do to prevent it. Definitely stretching. So I agree with Adam. I'm not a big proponent of static stretching before activity. I just don't think it makes a lot of physiologic sense. I mean, if you're preparing to move, why would you sit there and hold one position for 20-30 seconds? I mean, so I do like dynamic stretching before, but I think static stretching is important as a maintenance. And so I recommend that people do it either after a run or, like later in the day, if they run in the morning, they do their static stretching kind of at night, or especially on their off days. Because you want to stretch out all those tendons. So when muscles contract, when you're constantly doing the same activity over, muscles contract and they shorten. And so you want to lengthen them back out. And so that's what static stretching helps do. The other thing is making sure you have good footwear. So making sure you have proper footwear that fits your foot. And so there's no one shoe that's the best shoe for every runner. But for each individual person, there are shoes that are better for that person than others. And a lot of it depends on your foot dynamics and how, if you have a flat foot or a neutral arch or a high arch, those kind of things. Now, we know that people with flat feet tend to be more prone to shin splints because it puts more pressure on the area, and especially people that do what people call pronate, or their ankles cave in when they run. They're much more prone to shin splints because they put pressure on it. So for those people, getting a good supportive shoe that helps build up the arch, or even some off-the-shelf arch supports or orthotics, such as like Power Step Superfeet, those kind of brands, can help. People like to foam roll. Foam rolling can definitely help. It helps stretch out the tendons, helps bring healing back in. And then icing, especially if you're having shin splints after activity, icing the area can kind of help manage some of the symptoms. So those would be my recommendations.
All right, awesome. And Adam, I know that you had talked about some things that you like to do before a run. So squats and, stretches that get you moving. Can you recommend any other training exercises that you would recommend runners do on their off days that may help them to strengthen or prevent injury?
Yes, and Bonnie, in 10 minutes, stop me if I'm still talking. Really, this is one of the biggest areas I think of interest to me and to our team here at HSS, whether they're the physical therapists or some of the performance specialists and the physicians, of course, as well. But in one word, I would say cross-training. And the thing I find here is that in many cases, people feel like they are going to train more by running more. And I think that single track mindset sometimes can lead to injury. My recommendation really is that you should train to run, not just run to train. And that might be oversaid, and it might be something that is people have heard before, but what does that really entail? I think that is a combination of getting that core to work, like we've talked about a little bit earlier. It's a combination of actually strength training, where you actually can use weights to strengthen your quads, which obviously are important for running, as well as the outer hip muscles, which are your abductors. Those abductors, to me, are key to many things to prevent injury. Plyometrics also are great to do in the days when you're not running. And to kind of, I guess, go through a little bit of those things, we've talked a bit about the planks already, but that can then be advanced to become something which you do against resistance on a band with bands, or you could do on something unstable like a plyo ball, or you could put a BOSU under your feet, and so you can increase the challenge of that core workout. But the prevention of injury part to me comes from, are you doing it well? And that's where we don't always know individually as people, as consumers, are we doing it right? So you could use a mirror to tell, and are you symmetrical? Are you even in your hips? And with all of that being said, it might make sense to some degree to consider coming in to see, again, one of our performance specialists. If you're not injured, you can see somebody here. If you are injured, then you might be more appropriate to see Dr. Robinson or myself. But crab walks are one of my favorites. You can go going from side to side with the band around your feet, those monster walks. That's a great exercise because that really hits the abductor group. So don't forget, I think to end off this question for me, and I could go for a while, but to end off, I think the thing to remember is that running is really a balance exercise. You're balancing on one leg and you're jumping to the other. And when you're doing that, if you don't have good control, something can break down in the chain, and that becomes sometimes it becomes pretty obvious when you see it on a slow motion video, which pretty much everybody has on their phones now, but we also do as a running analysis. But that part of training on one leg, I think, cannot also be overemphasized, because that's kind of what running is, that explosive pushing from one leg to the next. Thank you.
Okay, great. Kind of to add on that, Adam, can other, exercise classes people might take, like yoga or Pilates or Tai Chi, can that help to supplement someone's running?
Yeah, I think in a short word, yes, absolutely. But like anything else, it's just got to be done smart. I've worked in one of our centers, the integrative care center. We had Pilates on site. We had some yoga instructors on site. There was Tai Chi. There was lots of complementary care. And so I got to practice a lot of that. And I think that if you know your body, or you're getting to know your body, these things can be great. But as you get to know your body, you might be very stretchy or flexible rather in your quads, but not your hamstrings. And then all of a sudden they're asking you to do down dog in a position where you're touching the floor, and you just like, maybe you just don't go there. So, I tell people yoga is a big world, and it's very hard to give it a blanket okay, because I do get perhaps just as many patients from doing things wrong in yoga as I might refer to yoga. Because if your body is hinging in a certain direction, or is predisposed to moving in a certain direction, and then you just keep pushing through that with yoga, and think how good am I doing? Look how flexible I am. But all you're doing is increasing the flexibility in one link that's already hypermobile. Well, yoga can be actually quite harmful in some cases. So with that being said, getting to know your body, maybe taking some one-on-one instruction first time out when you're doing yoga classes, or with a Pilates instructor, to get to know what's right for your body and where you need to focus. That makes sense. And then going on to maybe more of a class setting or a video setting or something like that. But I love yoga. I'm always learning more about myself, and every week is a different week. And I love the balance and the control, and that ties right back into the challenge of running, which is going from one leg to the next and balancing. And a lot of yoga complements that.
Yeah, that's a really great point, about knowing your body. And I think when people take a yoga class for the first time, I know I've done this, you get kind of pressured. You want to be doing the movement like everyone else, but just being aware of, if you feel any strain, if it feels wrong, don't do it. Don't push yourself. So that's a great point.
I think I joke around, and I would say that if you're fresh off the couch, make sure you take things slow. Right? So, yes.
Definitely. All right, and as we're moving into more managing injuries type questions, I'm just going to encourage anyone who's watching, type your questions into that Q&A button at the bottom of your screen, and we can answer them that way. So, Dr. Robinson, what are some of the most common injuries that you see from outdoor or long distance runners in general at your office?
So most runners present to us with kind of your overuse type injuries. I mean, you do have the occasional acute injuries, the ankle sprains, the things like that from, hitting an uneven surface, but mostly they're overuse injuries. Probably most common is what we call patellofemoral syndrome, or people call runner's knee. You'll also hear it referred to as anterior knee pain or chondromalacia patella. That's probably one of the things that we see most commonly, and that's why it's called runner's knee, is because you see it a lot in runners. And it's anterior knee pain and pain underneath the kneecap with running and exercise and jumping. I also see a fair bit of distal IT band syndrome. So tendinitis or pain at the IT band on the outside part of the knee. Also some in the outside part of the hip, but usually in runners, it's more in the outside part of the knee. I think something that's under-recognized but very common in runners is distal hamstring tendinitis. So the medial hamstrings, or semimembranosus, semitendinosus, as they come across the knee and attach onto the front part of the lower leg. It's very common to get tendinitis there in people that do repetitive flexion exercises, so especially runners. And then, of course, and then the stress fractures. So the, stress fractures, the overuse injuries. So what a stress fracture is basically every time you're doing exercise or doing weight, especially weight-bearing exercise on a bone, you kind of have micro trauma. And the body heals that as it goes. You do the micro trauma, you rest, your body heals it. In a stress fracture, the trauma starts out increasing your body's ability to heal it. And so you start to get into this pattern where you're damaging the bone, but your body can't recover enough before you start damaging the bone again. And then eventually you start having pain and you get a stress fracture. And if you continue to run through that stress fracture, eventually the bone will break completely and you'll have a real fracture. And so I tell people things that you need to watch out for. So pain that increases the more you run is usually something that you need to get checked out. So typically, if you have a little bit of pain when you first start and then it goes away and it doesn't come back again, that's usually in general not something that's dangerous or something to worry about. But if you run and you're not having any pain, and then by mile 2, mile 3 it's starting to hurt, and by mile 6 it's killing you and you have to stop running and walk, that's concerning and definitely concerning. Or if you start having pain after your run, so after you run, then my foot hurts when I walk for the rest of the day, that's very concerning for a stress type injury, and definitely something you need to get checked out.
Good to know. And can you speak a little bit about runner's knee specifically? Can you treat it at home? How do you know if you need to go in to see a doctor for it?
Yeah, so there are definitely things that you can do for runner's knee. So patellofemoral syndrome it's basically a maltracking of the patella. So if you look at your femur has two big condyles on it, two big knuckles, and your kneecap should kind of glide in between those knuckles. And for some people, it kind of bounces around and it doesn't track completely properly. And so when that kneecap hits on those knuckles, it hurts and it'll irritate the fat pad, which sits underneath the kneecap, which has a lot of vascularity and nerve endings, and it can be quite painful. So the biggest probably misconception with runner's knee is that it's a knee problem. No, runner's knee is not a knee problem. Runner's knee is a hip problem. It's a core problem. It's actually very little of a knee problem, because the mechanics of how your patella moves comes from higher up. And so it comes from your hips, it comes from your core, it comes from your quads and your hamstrings as well. But really, when you're focusing on it, you need to be focusing on strengthening your glutes, strengthening your core. As Adam mentioned, depending on your cadence, how fast you run, and your stride length, as much as 90% of your stride is one leg. You're on one leg 90% of the time when you're running. And so if you can't stand on one leg and hold your pelvis stable, then just think, when you're running, your pelvis is doing this the whole time you're running. And so that's going to cause knee problems and things like that. We know people that when they run, when their knees cave in, called a valgus motion, they're more prone to get runner's knee, which is a problem with weakness in what are called the hip adductors, so your glutes, your piriformis. So those are things that you can do at home, working on core strengthening, cross training, those kind of things. Certainly, if runner's knee is mild, so it's a mild little ache, you can ice it afterwards. You can take some anti-inflammatories, things like that. When it starts to get really bad, or when it's stopping you for run, certainly that's when you need to see somebody, and making sure that that's really what you have. I won't tell you how many times people come in and say, I have runner's knee. And I'm like, no, you don't have runner's knee. Or I have IT band. And I'm like, no, you're not even hurting over your IT band. Like that you have, not all knee pain is runner's knee. And so the other thing I tell people to watch out for is swelling. If your knee swells, so if after you run, if your knee swells, it could be runner's knee, but it's very likely something else. And you definitely need to get that checked out by a professional, a sports trained, a doctor that knows that is familiar with those type of injuries, and make sure that, there's nothing else going on.
And Adam, would you like to add anything when you see people come in with runner's knee, what you guys typically do with them?
I mean, I just wanted to take a chance to say that there's not that many things, and it's hard to change your style of running. But sometimes one of the things that helps, whether it's Achilles tendinitis or runner's knee, and I love Dr. Robbins' suggestions about the strengthening. So usually I would just go with that. But the one modifiable factor that many people can do is to just change how many foot strikes they have per minute. And some people may be overstriding, which could lead to overuse, like we were talking about the runner's knee, or it could lead to shin splints, or it could lead to Achilles tendinitis. Lots of little things may be modifiable or maybe decreased. A little discomfort can be decreased with trying to take potentially a shorter stride or more steps per mile, like targeting around 170 foot strikes per mile, like that, or per minute rather.
All right.
The other thing too with runner's knee is, I find that it's more common in people that do a lot of uphill or downhill running, because you do put a lot more pressure on your kneecap when you're going up and especially downhill. And so, like, if you are having some running knee symptoms, and let's say you're running in Prospect Park, maybe even changing up your course and trying to find something that's a little flatter. It can be hard in the city to find flat ground running, especially if you're doing any kind of long distance mileage. But just changing up your running pattern and maybe trying to find a new course or something like that can help as well.
All right. Yeah. And Adam, are there any recovery tools or at-home equipment that you would recommend for managing any of these running injuries we've been
Yeah,
mentioning?
absolutely. I mean, I have probably 3 or 4 different foam rollers of my own, and here in the clinic we have a dozen. So to me, getting the right kind of pressure that you can apply to yourself is a great way to promote your own recovery. And not everybody necessarily knows that the different colors mean different things if you're working within the same company. So we have here a pink one, which was very, very soft, and a blue one, which is more like the palm of your hand, and then a white one, which is more like your forearm, and then a black one, which is more like your bony forearm. And those different foam rollers could be used to different effect for different parts of the body, depending on how tender you are. So foam roller collection, all for it. In addition to that, I think that different balls could be useful. Some people use a tennis ball or different shaped and different density balls. But to me, the biggest thing I notice is people often they're just rolling and they're ironing. And I find it's more effective or it can be more effective if you take a moment to melt onto that device. So soften yourself when you find the tender spot. Don't just kind of speed past it. Stay there and breathe. Let it slowly do its work. And then you can just change your angle by 1 or 2 degrees, and you find a whole new world of pain that needs to get worked on. So foam rollers are some of our biggest friends, I think, and little massage balls.
All right, great. I'm gonna have to get another foam roller. Dr. Robinson, I know we mentioned Achilles tendonitis briefly. Can you recommend what kind of treatment you would normally, give to your patients?
Yeah, so Achilles tendonitis and plantar fasciitis are really common in runners as well. And so the mainstay of treatment for Achilles tendonitis is a stretching program called an eccentric stretching program. That's the one in the studies that has been shown the best to help improve symptoms and get symptoms to resolve. So when you're talking about the Achilles, a calf raise or going up onto your toes is a concentric movement. So the eccentric movement is the lowering back down. So when you do a calf raise, you want to do the calf raise, and then you want to slowly go down. And then if you have like a block or something where you can even go past neutral, that's the best. And you want to do those very slowly, kind of repetitively. Now, when you have bad Achilles tendonitis, those are going to hurt a little bit to start. So you have to be very careful with how many you do, and you have to, not do too many. But as you start to get better, you'll be able to do more and more and more. Also, Achilles tendonitis responds really well to the static type stretching because you want to lengthen back out that heel cord. And so you definitely want to do a lot of static type stretching. Certainly you can definitely foam roll into your calf and help loosen up your calf, those kind of things. You can use the massage gun type things to help loosen up those muscles and things like that. The big thing I tell people is with those massage guns, you never want to massage the actual point that's the most tender. You're probably just going to irritate it and make it more tender. You want to massage above and massage below, and you never want to massage over a bone. You don't want to over a bony prominence. You don't want to like massage right over a bony prominence. That'll just hurt. But the other things that can help with Achilles tendonitis, certainly shoe wear, some changes in shoe wear can help. So, all the rage lately has been what people call zero drop shoes, or the free shoes, or the barefoot running shoes, as kind of we get to the minimalist type shoes instead of these big supportive shoe wear. Well, for people with Achilles tendonitis, those tend to actually make them hurt worse. And so people with Achilles tendonitis need a little a little lift in their heel. Their heel needs to be a little bit higher than their forefoot. So they need a little drop in their shoe. So getting a shoe that has more of a drop to it can definitely help with some of the symptoms, especially for symptoms are only when you run, which a lot of runners with Achilles tendonitis don't really have symptoms with day-to-day activity. It's mostly just when they run. And so changes in shoe wear can definitely help as well.
All right, great. Adam, is there anything you want to add for Achilles tendonitis?
Oh, I think just that, tendons are sometimes slow to heal. So, the itises can, are inflammation. They can lead to more breakdown down the road. And I would just say this is one of the times where you really, whenever you're really injured, you don't want to be running through pain. And that's kind of leading into some other questions. But with things like tendonitis, I'll often recommend if you aren't getting better on your own, that's a good time to consider maybe you need to come in to see somebody, especially if you have like a bump or a nodule down there, and if it's going more into the tendon as opposed to into the musculature. If it's really a tendinitis, it's another idea to get checked out, because if it's not responding after a couple of weeks and it's getting worse and you're still running on it, there can be a risk to it really weakening the tendon. So as far as treatment goes, of course, ice as well.
The other thing I would also add to that too, that I kind of forgot to mention, is that, when you have Achilles tendonitis, the worst scenario is Achilles tendon rupture. And that's the injury that we always get concerned about. And so if it's getting worse, if it's not getting better, you have to rest. If you continue to run on it, it will eventually pop. And then you're talking surgery, or at least an 8 to 9 month recovery until you're running again, so I think that pay attention to your body and knowing when it's time that, no, this is really bad. I've got to stop. I've got to rest. I got to see somebody.
All right, great. And that kind of, is leading to one of our last questions. So if anybody has questions for the speakers, type them into that Q&A button at the bottom. So if somebody has one of these injuries, Achilles tendonitis, runner's knee, how long do you recommend that they don't run, that they take a rest period? How many days should they take off?
I mean, so one, I think that's very variable depending on the injury. And it's also very variable depending on the person. And so, and I think a lot of things play into that. How long has it been going on? Things that have been going on longer and more chronic are going to take longer periods of rest than something that's more acute. But in general, kind of a general rule that I tell my patients is I would like them to be pain-free with walking for at least a week before they start trying to run again. So they need to be pain-free in their day-to-day activity. They don't need to have any pain walking before they start trying to get back into running. Typically, I recommend that people follow what I call the 50% rule. So when you first start back, you take whatever mileage you were running before and you cut it in half, and you cut the days of the week that you're running in half. And that's where you start. And so if you were running, let's say you were running 5 miles, 5 days a week, that's 25 miles a week. So you would cut that down to 12 miles and you would split that over two or 3 days. And then you follow a gradual progression. We know from studies, from our injury prevention studies that have been done here at HSS and elsewhere, that mileage increases of greater than 10 to 15% a week are risk for injury, and both overuse injury and stress injury. And so sticking to that, increasing at 10% a week. So, if you're running 12 miles a week, then you would increase it by 1 mile a week. I tell people you either increase your mileage or you increase the days a week you run. You never increase both mileage and days a week you run on the same week. And so like that, if you're following, like if you're going to be running for, for the first time, you're going to be training for something like a half marathon or something like that, following a set program. Most of those set programs are built in to accommodate that 10 to 15% increase. And so that can give you a very structured, okay, I'm going to do this here, but knowing that you can vary it, because everybody's a little different. If it feels like 3 miles was a little bit much for you to run that day, then don't run, cut it off at 2, cut it off at 2.5.
All right. And Adam, is there anything you want to add to that?
No, I mean, I just want to take a minute to invite any of the participants to ask questions because, this is a great opportunity to ping us and to pick our brains. But the idea that I would apply to getting how long to rest or how long not to run, I would, similar for many injuries. And I would look at symmetry. First of all, like Dr. Robbins says, you should be painful with your everyday activities. You're able to have pain really under control from a 0 to 10 scale. That's like a 0 or a 1. I think that the left and right legs should be within 90% of each other. Can you have the same amount of strength on one leg as you do on the other, or whatever the affected body part is? That could mean how many tippy toe exercises can you do one leg versus the other? Can you hop on one leg 20 inches and on the other one only 10? Or what is your confidence with hopping? And not just hopping once. Can you hop 1, 2, and 3 times? And to really test that as well, to make sure those are cleared before I have somebody even really consider running. Because if it hurts for them to hop a bunch of times and they can't do tippy toe 15 times in a row full height, I wonder if they're really ready to try running. So however long that takes.
All right.
And I think one point that I always try to emphasize to my runners is because they think that if they can't run, that they're just going to go completely downhill and they're never going to be able, so you can definitely cross train. Like, with most running injuries, you can bike and without much pain with a lot of the overuse running injuries. So biking, you can keep up your cardiovascular fitness and everything so that when you go back to running, you're in a much better place. You're in a much better shape. Swimming, again, non-weight bearing kind of things, if you have an injury, talk to your doctor about what can I do? What kind of things are going to be okay for me to do that aren't going to exacerbate this? We talked about cross training in general, and I think that it's an important point because so many runners, that's all they do. They just run, and I don't have any other athletes that all they do is their sport, even our professional basketball players, yes, the only sport they play is basketball now, but they still weightlift, they cross train, they're doing everything to take care of their bodies. And so if you're running and you're, running a lot and you're a distance runner, then you got to be doing other activities to take care of your body. If you do the same activity over and over and over and over again, your body's going to wear down and it's going to break down. And so I am a big proponent in runners of cycling. One, running is a very hamstring centric exercise, whereas cycling is much more quad centric. And so you get to work out the other side, your antagonist muscle, which is always important. You don't want to be imbalanced, but, and then we talked about lower impact. It's a lower impact activity. The big thing is I try to keep runners away from also doing another high impact cross training, just because that puts more stress on your bones, especially when you're ramping up your mileage. Like, let's say you're training for a half marathon, training for a marathon, you're already putting a lot of stress on your tendons and bones. If you're doing something else that's also very high impact, that's putting even more stress. So I typically recommend lower impact activities for those cross training events. So biking is a great one. Swimming is a great one. Weight training, all runners should be doing some type of strength training, in my opinion. Now, that may be controversial, but everybody should be, I think everybody should be doing some type of strength training. But, like Adam talked about, balance work, those kind of things. There's lots of things that you can do to help improve your running, even if you're not able to run.
That's a great point. And I had one more question, kind of talking about people that might be training for a marathon or a half marathon, and they're running these really long distances. It's probably mostly what we talked about, but to the extreme. So they have to plan out their, training schedule, how much they're going to add on to their mileage each week, be aware of their body and everything. Is there any other tips you have from like patients that might have been training for a half marathon or something that you might want to give the audience in terms of preventing injury and just, staying safe?
I'll say briefly, I think that if you're running already 15, 18 miles, you can do the marathon. I think what I mean is it's overtraining. And, the people have these training logs and their goals, and they're coming into these areas where they're hitting the higher miles and more numbers of runs every week. And they start to wear down, and they really want to get to whatever the book says. And I think that overtraining is hazardous, and then they don't make it to race day because they've overtrained to get there. But if you're running 15, 16, 18 miles, I think that you're already going to do pretty well for the most part.
I mean, I'll just reemphasize. I think that especially if you're a first timer, following a set program is important. So whether that's a local running club that gives you a set program, whether that is a national program from a running coach that, most of them, you can find a lot of free programs online. Following a set program is important. The other thing I think we didn't mention when running in the city, but bring some form of payment, whether it's your cell phone for Apple Pay, a credit card. That way, like that, if you do run out of water, if you do run out of Gatorade, you can swing into a store real quick and get some. Or let's say that you're feeling lightheaded and you think you need something to eat. You can swing into a convenience store real quick, grab a bar, grab something to eat. Or let's say you get out 15 miles from your house on your 20-mile run and you sprain your ankle and you got to get an Uber, home or something like that. So, I mean, making sure to prepare for, having, something with you that, that you can get in case in case things don't go as planned.
Yeah, that's a great point. Thank you. I think that's all the time we have for today. Thank you so much to Dr. Robinson and Adam. That was a great talk, and I think that everyone learned a lot about how to, enhance their running this summer outdoors. And thank you to everyone that joined. So if you have any more questions, you can always email us at pped@hss.edu.